Hello, my name is Midwife Marley and I'm going to show you today how normal physiological childbirth should look using my model, Bertha, and my little dog. So I'm just going to get into a better position so you can see what I'm doing. Now please do ignore the fact that Bertha has had an episiotomy. That's just how, which is a cut of the perineum, that is just how the birth model came, okay? But I will talk about episiotomy in a completely different video. So let's pop baby in here. So she's going into the birth canal, or he. I think in this case this one is a she. And what usually happens is once you've gone through the labour, you get to transitional phase where you're going, you're approaching full dilatation, which can be quite an intense phase to go through. Once you pass that and you get to full dilatation, then that is the point at which you will probably, if the baby's head is low enough in the pelvis, probably start to feel the involuntary urge to push. And at that point, then we hope that baby will be born quite soon. So when you get to the point where you've maybe been pushing for a little while and then baby's head is really low down, you can actually see because baby's got lots of hair there. But before I start, I'm just going to show you how it looks from the other side. So just bear in mind the baby's body is sideways. So you have a contraction, baby's head will come down, the uterus will push the head down, the contraction will go, and then baby's head might disappear for a little bit. And it'll go on like this for quite some time. So you'll be pushing, you see the head, you stop pushing, the head disappears. You push, you see the head, it disappears, backwards and forwards, and this can go on for a little while. And then eventually your baby's head makes it round that U-bend in that birth canal and will finally be born. So you'll get to a point when baby's head is about here. Baby's head is about there, and you will probably start to feel a little bit of stinging, okay, at this point. And at this point, your midwife, nurse, doctor, whoever will say to you, okay, now baby's head is coming, and obviously they don't want you to tear, so to just breathe, try to gently breathe your baby out, okay, because that allows the perineal area to stretch. I have got another video, by the way, on perineal massage, so do have a little look at that. But it allows the perineum to stretch. So when the baby's head gets to about here, they'll say to you, right, okay, just slow down and just slowly pant and try and breathe the baby's head out, basically. And then you'll have another contraction, and gosh, this is so tough. The baby's head will slowly, you see she's coming, baby's head will slowly be, Bertha is a real tough one. Okay, so you can see there, baby's head is now out. Baby is looking down. But if you look at her body here, her body is still sideways. So what's going to happen? Well, what happens is something called restitution. So the baby's head turns on its own. We don't need to turn it. Turns on its own like that. So you'll see the baby go, ooh. Restitution occurs. And now the baby is in line with her body, as you can see there. On the next contraction, which they tend to slow down a little bit, so they may well have been coming like every 2 to 3 minutes before, and then as you're giving birth, the contractions can slow down a little bit and can occur every 5 minutes or so. And on the next contraction, what usually happens is the baby's head comes down the shoulder, or the anterior shoulder, so the first one there pops out, and then the next one pops out, and then baby is never usually this rough, by the way. And then baby is born straight up onto the chest for a bit of skin to skin and hopefully a little bit of delayed cord clamping. So this is just an example of your normal physiological childbirth. I will be doing more videos talking about shoulder dystocia and things that may happen, but this is how it usually goes in absolutely normal circumstances. So I hope you enjoyed that little demonstration. I'm absolutely worn out now trying to do that. But yeah, any questions, any comments, then please put them down below.